The last time I went to a hospital with my grandmother, we have to carry this big pile of files that she's collected over 70 years of her life.
Correct.
For the doctor to know all her medical history, which medicines she's taking. Why can't there be, like your Aadhaar card, your Aadhaar number presents so much information about you? Why can't there be a health ID?
Now, it is a transient phenomena. I'm quite optimistic that in the next 5, 7, hopefully not 10 years, India will transform. So we are still at a very formative stages of the digital transformation of healthcare in India. And it's going to take a long time before some of these things are going to be used at scale. Because remember, you can only use AI at scale when you have underlying data which is digital. If you don't have a digitized healthcare ecosystem, then most times the AI tools can only be used in a very limited way because they don't have the data on which to actually make those decisions. Imagine today, there were 2 grocery stores in your vicinity. Earlier, you could not do a UPI transaction, both these stores. Now, between these 2 shops, one of them started offering UPI, the other was still not offering UPI. So you'll start using this shop more. Over a period of time, one of 2 things will happen. Either this shop will disappear or this shop will feel the competitive pressure of you as a consumer not going here anymore, but only starting to use this other shop services and will start to offer UPI again. You'll start to see the same thing in the healthcare world.
Hello and welcome to ISB's special show, Leaders Unplugged. I'm Priyanshi Sharma, a journalist and currently a student at ISB. Today we have an incredible guest joining us on the show. When we talk of some labels or brand names, he's one person who has a string of those attached to his name. Talk about IIT Bombay, MIT, becoming an entrepreneur, McKinsey and Company, you name it, and he has it all. But he's somebody who's not about the brand names. He's about creating real impact and real difference. He's currently one of the primary drivers of digital transformation in India as the chairperson of NABH and the co-founder of CitiusTech. It's an absolute honor to invite and welcome Mr. Rizwan Koita on the show this morning. Thanks very much, sir, for joining us on this show. I want to first ask you this, that in the times that we're living in, it's a trend to become an entrepreneur. It's a trend to raise funding. It's a trend to want to one day own a unicorn company. But you did it before it was so trendy or before it was a buzz like it is today. And you did it without raising any funds, which is something that we rarely see today. So being one of the OG entrepreneurs, if I can call you that, of this new startup wave, you created a unicorn back in the year 2019 without raising a single rupee. How did you manage to do that? And how did you not give in to the pressure of raising capital?
So first of all, thank you very much for having me here, Priyanshi. It's a pleasure to be at ISB and spend time with you all. I think I became an entrepreneur. I was with McKinsey and Company for about 5 years, and I left McKinsey to be an entrepreneur. The first company that I started was in the BPO space. We started and ran the company for about 4 years before we sold it to the Aditya Birla Group. And in 2005, we were looking at sort of starting our next gig. And because the previous organization had been venture capital funded and it was modestly successful, we felt that we would try and see if we can find a way to build the business, the next venture that we were starting without raising capital. And we gravitated towards business opportunities which would not be very capital intensive, right? So for example, there are certain types of businesses, if you are going to do, then you need a solid amount of capital infusion upfront. There are other businesses that you can do where you have the ability to get to a certain level of profitability or a certain level of cash flow earlier in your life cycle. And because of our desire to experiment with a new model of not raising venture capital funding, we thought about about starting a tech services company with a focus on healthcare, a healthcare tech firm. And fortunately for us, with a little bit of seed capital that we put in as founders, we were able to, at the end of the first year, get to a point of being break even. And then after that, it was a very profitable company. So we were able to charge a premium for what we did.
Yeah.
And not only was it high growth, but it was quite profitable. And we were able to then, sort of create that nice virtuous cycle where, we had high growth, we had high margins, and then it kept on feeding on itself, right? So I think we were lucky in some ways that we were out there looking at the right opportunity at the right time. The other thing which I think were sensitive to is the fact that because we had to be self-funded, we had to, one, be very disciplined about our cost structure. So we could not do something terribly imaginative, which would require a lot of capital. So we had to, systematically build it. And the last point I'll make is that we had to be measured about growth expectations, right? So if you go and raise a lot of money, you can hire 100 salespeople, then you have a different trajectory. If you have to self-fund it, then you do it in a measured way, step by step. But we were not rushed for time. So it took us a while from the time we started the company in 2005 to becoming a unicorn in 2019. It took us 14 years to do that. But on hindsight, it was a phenomenal ride, and I wouldn't have done it any other way.
Yeah, it's slow and sustainable, if that's
you
what
could
we
say
can
that.
call it.
Yes,
Yeah.
yes.
That's, I think, every entrepreneur's dream, to be profitable, that too without raising any money. So much to learn for all entrepreneurs in that one answer you gave. But now moving to another space in which you've set an example apart from the startup space, and that's healthcare. Now, when we talk about India's digital health transformation journey, you are a big part of that currently. And we also compare ourselves with other countries. We look at developed countries like the United States to see how we can be better and to see what we shouldn't do. Now, you're somebody who's seen the United States transformation under the Obama era fairly closely. What do you think we can adopt from their model, and what do you think we should completely avoid learning from their lessons?
Sure. If you look at India, about 30% is government-owned healthcare. And even that is a system where some of it is controlled by the central government, but a lot of healthcare is actually at the state level, where each of the states in India have their own policies and own practices of how they want healthcare to be dispensed in their respective states. And then 70% of healthcare is in the private sector, where each hospital or each lab or pharmacist is really being driven by what they can or cannot do based on the ownership and what the founder or what the owner of that particular facility wants. So to achieve anything in India with limited resources, with a highly fragmented healthcare ecosystem, with this interesting, a segue between 30% government and 70% healthcare being in the private sector, creates a significant amount of complexity. Okay. Now, what we learned from the US is that there is a structured approach to how healthcare can be done. It needs a few important stakeholders to work together very closely. The healthcare tech community, the companies who are building healthcare software, they have to have the right direction and the right incentives to build products which are aligned with the national strategy. You need the hospital community to be, and the doctors to be aligned to ensure that they are willing to implement solutions and tools which are being developed by these vendors. And finally, one of the biggest beneficiaries of digitization is actually the payer organization. The payer, in many cases, the government, and payers many times is the health insurance companies, and many times the payer happens to be the self-funded individual, right, who is kind of paying for health records.
Right.
So the important learning for me about what happened in the Western world and what will be important for India is that for anything to work in the Indian context, or for that matter anywhere in the world, we have to align the business interest of the tech vendors with the business interest and the abilities of the provider organizations, the hospitals, the doctors, along with the incentive structures for payers, which are the government insurance companies, private insurance, and private individuals. If you can find a way to triangulate the interests and the success factors of all these three important stakeholders, then we have a winner. If we simply work on one or two of these entities and forget about the third, then it's a much harder success to achieve. Yeah.
Right, that's very interesting. In fact, my next question was something on these lines, that when we talk of digitization in India, the first thing that comes to our mind is the India stack. You think about UPI, you think about DigiLocker, all of these things which have changed, which have completely transformed our everyday lives. But when we talk of digitizing healthcare, it's not as easy. So while some people might compare the two forms of digitization, it's very different. So tell us something about the specific challenges of digitizing healthcare, and what do you think it takes to bring more than 60,000 hospitals together in this digital age?
The problem in healthcare is that the government now has a stack called ABDM, Ayushman Bharat Digital Mission Stack, which is supposed to connect two healthcare organizations, a hospital A and a hospital B. Number one problem is that there are, depending on whom you ask, between 70,000 to 100,000 hospitals in India. So unlike banks where 10, 15 banks were all it took to digitize, here you have 70,000 to 100,000 hospitals.
Right.
And then you add another couple of 100,000 pharmacies and couple of 100,000 labs, and you can see the level of complexity. Okay. Number two, most hospitals don't have the digital infrastructure required to connect to the ABDM gateway.
Right.
Because they don't have what is called electronic medical records. So unfortunately, for healthcare, while in the case of UPI, the UPI bridge came 10 years after banks got digitized, the ABDM bridge has come 5 to 10 years before the hospitals have got digitized. So we are finding it difficult to move transactions for healthcare.
Right, and just adding on to that a bit, that we've now spoken about the hospital side of this problem. Let's come to the consumer side of this problem, the patient side of this problem. So the last time I went to a hospital with my grandmother, every time, in fact, I go with her, we have to carry this big pile of files that she's collected over 70 years of her life.
Correct.
For the doctor to know all her medical history, which medicines she's taking. But in this day and age, every time I go to the hospital, I'm amazed that we still have to do this.
Correct.
Why can't there be, like your Aadhaar card, your Aadhaar number presents so much information about you. Why can't there be a health ID that presents your entire medical history to whichever hospital you might go to? You might go to a new hospital in a new city and you don't have to carry your records.
So today the problem is that the hospitals don't have the ability to either send or receive data because they don't have the electronic medical record. Now, it is a transient phenomena. I'm quite optimistic that in the next 5, 7, hopefully not 10 years, India will transform. What that means is that imagine today you had to go to a grocery store. There were 2 grocery stores in your vicinity. Earlier, both were not accepting UPI. You could not scan UPI or you could not do a UPI transaction, both these stores. Then you would grudgingly carry cash and you would do whatever you needed to do. You would do your shopping. Now, between these 2 shops, one of them started offering UPI, the other was still not offering UPI. Then you as a consumer who was a more, sort of digitally savvy consumer, you would say, hey, you know what? It's such a pain going to this store because I have to carry cash. Here, I don't have to carry cash. I'm UPI, I'll just scan it and I'll be able to pay directly.
Yeah.
So you'll start using this shop more. Over a period of time, one of 2 things will happen. Either this shop will disappear or this shop will feel the competitive pressure of you as a consumer not going here anymore, but only starting to use this other shop services and will start to offer UPI again. But as long as both are not offering, they don't feel the competitive pressure. Once one starts offering, then others start to feel competitive pressure.
Right.
You'll start to see the same thing in the healthcare world. That some of your doctors and some of your hospitals will start to go digital. The moment that starts to happen, then you as a consumer will say, you know what, here I have to carry all my records, but here I actually don't have to carry records because they already have access to my previous records.
Then of course that's what
you will start going more to that hospital.
Yeah.
So that is a evolution of the industry. So we're at the early stages of the evolution, but hopefully it will swing in the next 5, 7, 10 years.
I'm waiting for the time I don't have to carry all those files with my grandmother. But Mr. Koita, it's another thing here is that there's a gap between the vision that we might have and the tech that that we can possibly even create over the next few years. So, as a part of the company that you started, CitiusTech, along with the Koita Foundation, you've played a big role in working on the tech part of this, on creating the tech for the digital health landscape. But do you think there are enough qualified people, qualified healthcare professionals in our country to execute that tech, to lead this digital transformation on the ground level?
So there are two aspects to implementing technology. One is software products, and one is the people required to do the implementation.
Yes.
I think there are enough software products. They may not all be there, but there is enough potential in the software products in India today to be able to scale. As the consumers start to buy more software, namely the doctors and the hospitals start to buy more software, India has enough technical talent to be able to support this transformation. So today, I would say we are at a very interesting point in the evolution of the digital health industry in India, where the biggest focus of mine is to actually get hospitals and doctors and labs and for pharmacists. How do we get that ecosystem to start to fire up? As they fire up, I don't think India is going to be short of either software products or technology professionals to be able to do that. Yeah.
Right.
It's not like everything is there in place, but that is going to be the rate limiting factor. It is not going to be, oh, there were hundreds of hospitals who are ready for digitization. We just don't find enough people. That is not going to be the scene.
That's very well said. And Mr. Koita, I started with saying that you're somebody who's done it all. And I truly meant that when I said that. And now you've also moved to philanthropy with the Koita Foundation. So I wanted to understand that you've moved from the corporate world, then to entrepreneurship, and now to philanthropy. How do you see those worlds coming together? How is the startup culture, the startup hustle now different from philanthropy? Are there still some things that you used to do as an entrepreneur, that you still, some habits that you possibly picked up from that phase of your life that you still use being a philanthropist?
So I run my philanthropy organization like a startup. So we have the same hustle as you would expect in a startup organization. Although by the time I left CitiusTech, we were 9,000 professionals. So we were no longer a startup at that point, yes, right, in some ways. But my foundation, the way we work, how we work, we run it like a startup.
I think if all philanthropic organizations work like that, this world would be a better place. But that also brings me to one interesting point that you had once mentioned, that there should be a Zomato-like platform for hospitals in India, that before ordering our food, we go through so many restaurants, we compare so many restaurants on different fronts like price, your quality, your reviews, and so on and so forth. But we don't have any such platform for hospitals. For something, it's amazing to think that for something so inconsequential as our clothes, we research so much and we get every possible piece of information we need about the fabric, size, price, everything. But for something that puts our life at stake, we don't have as much information when we're entering a hospital. So do you think there'll ever be a time when we'll have such transparent information from hospitals to patients so that they can know everything about a hospital, the professionals in it, before they make them responsible for their lives?
So, the simple answer is yes. Okay, there is information at multiple levels that can be exposed to the consumer while making a choice. The most basic information is, where do I need to go? So, for example, we saw the most sad stories where during the time of COVID, where you would have a patient who was very sick, and just the mere task of finding a COVID bed, the ambulance had to go location by location, and several people died, or hundreds of people across the country may have died, just not knowing which hospital has a bed.
Yeah.
So information as basic as, I'm traveling on the Bombay-Jaipur highway and my car has an accident at 1 o'clock in the night, from the location that where I am at that point to which is the closest hospital that has an emergency department room which is open, just that information is something that I think should be and can be made available very quickly. And the fact that we don't yet have it, I think, is quite sad at the country level.
Yeah.
Because it doesn't really need any more digitization of anything, right? It's just about capturing which hospitals have an emergency department. Is the emergency department open 24/7? If not, what are the start end times? And with that information, you should be able to make an app which says, okay, any given place you are in the country, you need to get an emergency bed, you know which is the closest location to go to. From that point to something which is on the other side of the spectrum, which is, hey, how well does this hospital do in cardiac surgery?
How many have they done?
How many have they done?
Success
right?
rate. And
what is their success rate for a certain type of procedure? It could be a kidney transplant, or it could be some other procedure. It could be whatever. To that end of the spectrum, to be able to get to where you have quote unquote reliable statistics coming out of the hospital is a very complicated on a relative basis, right? Because that requires the hospital to get digitized.
Yes.
So that the metrics that are coming out, see, the metrics are only reliable if the metrics are getting computed in an automated way where it is not easy for somebody to intervene and change the numbers, right? In some ways, right? Otherwise, you could only track things and have confidence in them if you truly believe that they were objective, right? If you knew that some information is objective, some information, God knows, is not objective, then at a collective level, the quality of the information goes down, then you don't trust any information, right? In some ways, correct? So I just want to tell you that the availability of information can vary all the way from really basic information, which again we don't have in India today, to the very complicated information, which will take a long time to come. In the middle, there are intermediate milestones as well, which can be very powerful.
While we're on the subject of tech and sitting in ISB, it's not possible to not talk about AI and how that might impact jobs, how that might impact the health industry. So with AI, predictive analytics, do you think it'll entirely just complement existing health professionals and their work? Or do you think it'll change some parts of their work fundamentally? Or do you think it'll cut some jobs in the industry?
It's going to be a combination of all of the above, but it's a very it's quite a distance away, because we are still at a very formative stages of the digital transformation of healthcare in India, and it's going to take a long time before some of these things are going to be used at scale. Because remember, you can only use AI at scale when you have underlying data which is digital.
Right.
If you don't have a digitized healthcare ecosystem, then most times the AI tools can only be used in a very limited way because they don't have the data on which to actually make those decisions.
Right. India did become an example for so many countries when it came to the Digital India stack and UPI.
Exactly. It's very similar to that. Very similar.
Let's hope we become an example in healthcare as well. And as we come to an end of this, we'd like to add a little bit of a fun touch to this conversation. There's a small rapid fire that we have a few questions. And you know the drill. You have to be rapid and fire. I'm going to start with the first question. One word to describe your entrepreneurial journey.
Passionate.
What excites you more, building a startup or solving systemic problems in healthcare?
Solving systemic problems in healthcare.
A book or podcast that has shaped your perspective on business or healthcare and that you'd recommend all youngsters or future entrepreneurs to read or listen to?
5 years of working at McKinsey.
Great. If not healthcare, which industry would you venture into?
I'd be a management consultant. Go back to management consulting.
One piece of advice you wish you had received before starting CitiusTech?
Just be more patient with people.
The most unexpected challenge you faced while working with NABH?
It's been a great journey, but if there was one, I would just say that, like with everything else, it needs a lot of persistence.
If you had to explain healthcare digitization in a tweet, what would it say?
Very complicated, be patient.
A startup in the health tech space that you truly admire?
There's a company called Dozy. I think they're doing phenomenal work. It's started by a bunch of IIT Bombay alums, and I think that they are onto something really big.
And our last question for the day, what's the one thing that keeps you motivated every day?
Solving tough problems.
That's a perfect note to end this conversation on.
Thank you
Thanks
so
very
much.
much,
Yeah, thank you
Mr.
very
Rizwan
much.
Koita, for
Okay.
joining us today.
Take care. Thank you so much. Yeah.